Hi, my name is Krystina Richardson, and I am a clinician for the Western Tidewater Community Services Board. Today, I wanted to talk to you a little bit about the SCIP OP department and the who, what, when, where, and why of what we do. What? SCIP OP stands for School Counseling Intervention Program, Outpatient Therapy. What this means is that there's no need for an office visit because we are in multiple schools across Suffolk. We service at-risk children who may have mental health disabilities that make it difficult to participate in or attend school, complete their work, whether it be chores at home or school-related tasks, and they struggle to express thoughts and emotions appropriately, and that means they're not doing tantrums at home, maybe throwing objects or raising their voices at adults, peers, and family members, and they struggle with social interaction. We work with these children Monday through Friday in school hours. So when you're at work and they're at school, we're at work too, working with your kids on how to deal with their stress, their trauma, or just their everyday issues that they find to be too overwhelming or upsetting to deal with on their own. If the school is closed, we conduct virtual or office appointments. If there's a holiday and it's a federal holiday, we do not work. Now, what we do in the schools is what I like to call active therapy. Children struggle oftentimes to talk to individuals, and they don't really know how to express their emotions or thoughts. So as a therapist, I bring in giant stress balls, squish balls, fidgets, Play-Doh, sand, kinetic sand. We make slime. We make bracelets. We play games like Uno to get your kids to talking. That may sound like all we're doing is playing, and sometimes we are, but there is learning through play. Children don't learn through talking all the time, and sometimes as therapists, we have to get a little active and a little engaged. Now, sometimes this can also hurt us, but most of the time it's very effective because it stops your child from thinking or starts them to think, because it gives them some way to redirect whatever is disrupting their brain. Now, the clinicians in SCIP OP are by appointment only, unless someone no-shows or cancels. And it's really important that you communicate with your case manager if you have one, or with your counselor if your child will not attend school. We are not a part of the school. We also conduct a group in your schools for 10 weeks, and this includes 1 teacher session, 2 parent sessions, and maybe 1 to 3 individual sessions for the children. This group is usually small, no more than 6 kids, and for 10 weeks we teach them how to deal with stress and trauma in their life. We teach them coping strategies, things such as deep breathing, counting, learning what their feelings and emotions are and where they're coming from and how to deal with those stressors and traumas. We teach them to digest things, taking things apart, not attacking the whole thing at once, because when we attack it, we freeze, or we fight, or we run. And ask, do I have a SCIP OP clinician in my school, and how do I sign up for services? If you are curious about signing up for services, you can call Western Tidewater directly at 757-403-7768. If no one answers, please leave a message stating that you would like to sign up for outpatient therapy services at whatever school you are at. If you have a case manager and you only have case management or TDT, you may contact your case manager and talk to them about being involved in therapeutic services. And then you can also contact the school. Your school administrators do referrals on parents and clients' behalves if they feel that it is needed for the child to be successful. Signing your child up